Hello! Today my group and I will be discussing two similar infectious diseases. These two diseases are oral herpes and viral hepatitis. The first topic we will discuss is oral herpes.
Oral herpes is an infection of the mouth and lips caused by a specific type of herpes simplex virus. It causes small, painful blisters, commonly called cold sores or fever blisters.
The incubation period of oral herpes lasts about 2 to 12 days. On average, it is about 4 days. Signs and symptoms for oral herpes include fever, tiredness, muscle aches, and irritability. Pain, burning, tingling, and itching may occur where the infection site is before the sores occur.
There are two different types of oral herpes, type 1 oral herpes and type 2 oral herpes. The first type we'll be talking about is type 1 oral herpes, featured right here. It's transmitted through oral secretions and sores on the skin. This woman right here has one on her lip. It can be spread through kissing or sharing objects such as toothbrushes and eating utensils, and this is known to be very contagious. The next type of oral herpes is type 2 oral herpes, which is shown right here. A person can only get type 2 oral herpes by sexual contact with someone who has the infection. Pregnant women with genital herpes can pass the infection to their baby during childbirth, which can be very harmful.
Herpes is incredibly common. Almost 50 million Americans have genital herpes. And genital herpes is caused by either type 1 or type 2 herpes. Type 1 herpes we think of as being the classic cause of cold sores around the mouth. And traditionally, type 2 herpes has been the cause of genital herpes. Today, that's really changing a bit. While most genital herpes is still caused by type 2, most new infections today are caused by type 1 herpes acquired during oral sex. Now, the interesting thing about herpes is that of the 50 million people in this country with genital herpes, only 10 to 20% of them actually know they have it. Herpes often won't cause any symptoms, so you can have it without knowing it. You can transmit it to someone without knowing it. And you can't tell a person has herpes by looking at them. Nice people get herpes, smart people get herpes. People have it without knowing it and unknowingly then transmit it to their partner.
There is no cure for oral herpes, but there are medications that can be taken to subside the signs and symptoms of it. These are these medications right here. They're called famciclovir, valciclovir, and acyclovir.
The risk factors of oral herpes include having a history of sexually transmitted disease, having a high number of sexual partners. Also, it should be noted that women are more susceptible to herpes because it's more easily transmitted from men to women.
The next infectious disease we will be talking about is viral hepatitis. Viral hepatitis is the inflammation of the liver and also refers to a group of viral infections that affect to the liver, as shown right here. Viral hepatitis can be either acute or chronic. Acute means that the inflammation of the liver lasts less than 6 months. Chronic means that the inflammation of the liver lasts longer than 6 months. Signs and symptoms vary for each. Acute viral hepatitis is fatigue, flu-like symptoms, dark urine, light-colored stools, fever, and jaundice. Chronic is mild and non-specific, and the diagnosis of chronic hepatitis is often delayed. The different types of viral herpes are in different categories. These categories are hepatitis A, hepatitis B, hepatitis C, hepatitis D, and hepatitis E.
Hepatitis A is the least dangerous form of hepatitis. It is caused by the hepatitis A virus. It has an incubation period of about 28 days. Usually, it is spread by food or water contaminated with feces that is carrying the virus. Hepatitis B is transferred by intercourse and by needles used by drug users. It can also pass from mother to child during childbirth. Hepatitis B is caused by the hepatitis B virus. Today, nearly 2 billion people are infected with hepatitis B.
If you have hepatitis A or B, your liver is inflamed because you have been infected with either the hepatitis A virus or the hepatitis B virus. Your liver is a soft, flexible organ that performs many important functions. The functional parts of your liver are called hepatic lobules. Your hepatic lobules filter all of the blood in your body. As the blood passes through, your hepatic lobules break down harmful substances. Remove bacteria and worn-out blood cells, and forms clotting factors that control bleeding. After a meal, your liver stores nutrients to provide your body with energy when needed. Your liver also makes a substance called bile. Your gallbladder stores bile and releases it into your small intestine to help digest fats in the food you eat. If you have hepatitis A, the virus entered your body when you were exposed to fecal matter from a person infected with the virus. You may have been exposed to the virus by eating contaminated food or water, contact with infected feces, such as during a diaper change, or having unprotected sex with a person infected with the virus. If you have hepatitis B, the virus entered your body when you were exposed to the blood or other body fluids from a person infected with the virus. This could have happened from sharing a drug syringe with an infected person. Other ways you may have been exposed to the virus include having sex with someone infected by the virus, sharing personal hygiene items such as razors or toothbrushes used by an infected person, direct contact with the blood or body fluids of an infected person, or when a mother passes it to her baby during birth. When either the hepatitis A or B virus enters your liver, it invades your liver cells and makes copies of itself. In response, your body sends immune cells to attack both the virus and liver cells infected with the virus. As a result, these liver cells become inflamed and then die. Over time, scar tissue forms around dead and infected liver cells, which prevents your liver from working properly. If you have a chronic hepatitis B infection, your liver contains a large amount of scar tissue called cirrhosis, which limits blood flow and results in permanent shrinking and hardening of your liver. If you have hepatitis A, your doctor won't prescribe any medical treatment because your immune cells will eventually find and destroy all of the hepatitis A viruses in your body. If you have hepatitis B, your immune system will usually remove all the hepatitis B viruses from your body. In some people with chronic hepatitis B, particularly children, their immune cells are unable to remove all of the hepatitis B viruses. If you have chronic hepatitis B and your immune system can't get rid of the virus completely, your doctor may prescribe antiviral medication. If you have a severe case of chronic hepatitis B, your doctor may recommend a liver transplant operation.
Hepatitis C is one of the most common chronic blood-borne infections in the U.S. It is usually spread through contact with contaminated blood or needles. Approximately 3.2 million people are infected with hepatitis C.
If you have hepatitis C, your liver is inflamed because you have been infected with the hepatitis C virus. Your liver is the largest organ inside your body and performs many important functions. The functional parts of your liver are called hepatic lobules. Your hepatic lobules filter all of the blood in your body. As your blood passes through them, your hepatic lobules break down harmful substances, remove bacteria and worn-out blood cells, and form clotting factors that control bleeding. After a meal, your liver makes and stores nutrients to provide your body with energy when needed. Your liver also makes a substance called bile. Your gallbladder stores the bile and releases it into your small intestine to help digest fats in the food you eat. If you have hepatitis C, the virus entered your body when you were exposed to the blood or other body fluids from a person infected with the virus. This could have happened from sharing a drug syringe with an infected person. Other ways you may have been exposed to the virus include having sex with someone infected by the virus, sharing personal hygiene items such as razors or toothbrushes used by an infected person, direct contact with the blood or body fluids of an infected person, or when a mother passes it to her baby during birth. During the early or acute phase of a hepatitis C infection, the hepatitis C virus enters your liver and invades your liver cells. Once inside your liver cells, the virus begins to make copies of itself. During the copying process, changes called mutations occur frequently in the virus's genetic material, leading to new strains of the virus. In response to the viral infection, your body sends immune cells to attack both the virus and the liver cells infected with the virus. As a result, these liver cells become inflamed and then die. Over time, scar tissue forms around dead and infected liver cells. The scar tissue prevents your liver from working properly. If you have a chronic hepatitis C infection, your liver contains a large amount of scar tissue called cirrhosis, which limits blood flow and results in permanent shrinking and hardening of your liver. A vaccine contains weakened or inactive viruses that train your immune system to recognize and attack certain viruses. However, frequent mutations in the hepatitis C virus make it likely that you will catch a version of the virus not contained in a vaccine. As a result, there is no effective vaccine for the hepatitis C virus. If you have hepatitis C, your immune system alone may destroy all of the hepatitis C viruses in your body. However, most people infected with the virus develop chronic hepatitis C, a condition in which your immune system is not able to destroy all of the viruses in your body after 6 months. If you have chronic hepatitis C and your immune system can't get rid of the virus completely, your doctor may prescribe a combination therapy consisting of an antiviral medication called ribavirin and injections of interferon, a medication that strengthens your immune system. These drugs are most effective against hepatitis C when taken together. If you have a severe case of chronic hepatitis C, your doctor may recommend a liver transplant operation.
Hepatitis D is also known as the Delta virus, an infection that causes your liver to swell. Hepatitis D is also caused by the hepatitis D virus. It is uncommon in the U.S. Hepatitis D is contagious and spreads through contact with infected blood or other bodily fluids. It is important to note that you can only develop hepatitis D if you have already contracted hepatitis B.
So I'm Dr. Cooper, and I'm going to be talking about hepatitis D. Hepatitis is inflammation of the liver, and hepatitis D is inflammation of the liver due to a virus called hepatitis D. And hepatitis D, also known as the Delta virus, was first described in 1977 in Italy. And hepatitis D is an interesting virus in the fact that it requires the presence of hepatitis B to infect the individual. So the signs and symptoms of hepatitis D are jaundice, abdominal pain, nausea, anorexia, and change in color of stools and urine. So once hepatitis D has been diagnosed, the treatment is really supportive care. if this is an acute infection. If the patient has not been vaccinated against hepatitis B, they should also have that vaccination. There is no specific treatment against hepatitis D. Interferon alpha has been used in severe cases of hepatitis D, and in very, very rare cases, liver transplant is the only treatment available. The most people at risk for hepatitis D are people in the Mediterranean, where hepatitis D is more common, and in IV drug users.
Hepatitis E is a liver disease caused by the hepatitis E virus. It is transmitted mainly through contaminated drinking water. It is a self-timing disease that resolves in about 4 to 6 weeks. Its risk factors include poor sanitation in large areas of the world.
So I'm Dr. Carolyn Cooper, and I'm going to talk about hepatitis E. Hepatitis is inflammation of the liver, and hepatitis E is inflammation of the liver due to infection by a virus called hepatitis E. Hepatitis E is quite uncommon in the United States, but it is transmitted by contaminated water and uncooked foods. It is most prevalent in Southeast Asia, India, and Mexico, but is not very common in the US. Signs and symptoms of hepatitis E are usually very mild: jaundice, fatigue, abdominal pain, anorexia, maybe nausea and vomiting. It can be much more severe in women in their 3rd trimester of pregnancy for unknown reasons. The treatment of hepatitis E is supportive care. It never progresses on to chronic disease. And the prevention of hepatitis E can be instituted by frequent hand washing with soap and water after using the bathroom, changing diapers, or preparing food, and avoiding water and ice of unknown purity, and making sure that vegetables and fruits are peeled by the traveler or individual.
Treatment. For acute hepatitis, the treatment is to relieve symptoms and maintain adequate fluid intake. For chronic, the treatment is to eradicate the virus and take measures to prevent further damage to the liver. Here are the risk factors: workers in the healthcare, sewage and water treatment workers, people with multiple sexual partners, HIV patients, hemophiliacs who receive blood clotting factors.